Okay, so hello, I am Dr. Deb Howell with Dose of Deborah, Rehab for the Heart, and I feel so grateful to have my guest today, Dr. Elizabeth Fields and
Child.
Files.
Yes,
Okay,
like child.
Files. Okay, and so let me read a little bit about your bio, Dr. Files. It's amazing. So let's say Dr. Elizabeth Fildes is a Filipino-American nurse leader who demonstrates passion and sustained commitment to improving health outcomes of persons in the United States and the Philippines who suffer from tobacco use and addictions in all its forms. Her unique systematic approach has included mobilizing nurses to provide education and therapeutic interventions to improve population health in direct support of the World Health Organization Framework Convention on the Tobacco Control and which is established to combat the global tobacco epidemic. Her progressive track record spanning almost 3 decades of addressing tobacco control as an educator, researcher, and international collaborator reflects successful, oh my goodness, like tongue twisting, ventures to seed ideas to healthcare, public health, and policy stakeholders, secure significant funding, and bring cutting edge programs to fruition through partnerships and empowerment of nurses. She has implemented programs that have had an impact at the individual, community, and country level. Using lessons learned from establishing the Nevada Tobacco Users Helpline, she parlayed her policy experience into more rapid implementation of similar programs in the Philippines. With faculty and student engagement to augment public health interventions, she applied solutions cross-culturally to make significant impact in clinical services and educational curricula in 2 countries. Dr. Files received her bachelor's in nursing degree at the University of Santo Tomas School of Nursing, Manila, Philippines, and her master's in nursing degree at Teachers College, New York, and her education doctorate in Loyola University, Chicago. She's a fellow of the American Academy of Nursing, a board-certified public health nurse, advanced, certified nurse educator, certified addictions registered nurse, advanced practice, and fellow of the International Nurses Society on Addictions. Whoo! Oh my goodness.
Such a tall order.
Holy moly. Okay, wow.
You didn't have to read all of that, Deb.
Wow. Well, you know what? I would just love to give credit where credit is due. You have had an extensive career, and thank you so very much for your dedication, to our healthcare system, the nurses, and clearly a more broader look at the global health spectrum. So sincerely, I am so grateful to have you here today, and want to recognize.
Thank you.
Yeah, for certain. So tell me what's going on right now, like for you. What are you doing these days in this time of the COVID pandemic crisis time that we have on our hands?
So my current work is on nurses' lifelong personal and professional development. And I mean that from a holistic standpoint. It's time for us to focus on how do we take care of healthcare professionals? How do we take care of, in my situation, we're focusing on nurses' physical, mental, emotional, and spiritual wellness. And how do you do that from how do we empower nurses to pursue physical, mental, emotional, and spiritual wellness so that they can handle things like what's happening in their workplace right now. And in addition to empowering the nurses, we want to look at different policies and processes where they work, where where they live and where they play and perhaps where they worship to support the well-being of the person, to support the well-being of nurses. So there's a lot of evidence, a lot of programs that have been done to support that need. And what we're trying to do is to work with nurses in our state to find out what would be most beneficial to them. And so we start with the information from the Health Institute that recommended, number one, that we develop and maintain a positive organizational culture that supports wellness and safety. Number two, that we implement evidence-informed policies and programs that support clinician well-being, reduce burnout, and increase resiliency. And number three, we want to reduce mental health and addiction stigma and increase access to treatment and recovery services. I believe it's a tall order, however, together we can, together and with a commitment, we can make this happen.
So this all-inclusive approach is to look at the individual nurse, right, and the collective nurse and training. I would look at the formative training to bring this about, because I think that the one thing that stood out for me was and what would be a deterrent to why people may avoid or just not say anything is the stigma, right? Is the, I don't want to, you know, first I want to get into school, I don't want to lose my job. You know, once you get there, you don't want to lose your position. And then when you're actually in practice, right, and if you're having a difficult time, you know, where do you go? Where if you say that you're having struggle, you know, that you're not going to have some repercussions that's gonna threaten your livelihood, right? Your place of employment, or even people judging, right? Judging a situation, judging a person, and so that last one really jumped out to me as why people would hold back, because I remember a gentleman who, he was an amazing nurse, and I could always count on him to be right there for me when I needed another hand, and he had so much experience in critical care. So his background in nursing and this rapid response was so, you know, like on point. And he ultimately, struggled with, I guess he had an injury, a back injury, and he was on narcotics. And ultimately he became addicted to narcotics. And over time there was some issue around that, and I, you know, and he was so good at covering it up. He was so smooth, he was natural, and he was just always there. And I never knew he struggled until one day he just wasn't there anymore, and he was fired. And apparently he had an incident before, but then, you know, so I don't know what assistance he received. I don't know if he had ever gone into, you know, any kind of drug rehab or anything. All I know is that he was like a top-notch performer. I mean,
And what a waste, right?
it was sad.
I think those are the things we want to work on. We want to prevent losing people like him, you know, and because more and, you know, more and more and more, we need to emphasize that substance use disorder is a chronic brain disease, and all of us, especially nurses, people in administration, need to treat it just like we treat any chronic disease, diabetes, hypertension, and so creating programs that will prevent this from happening. And just like what you said, it'll really start from upstream. We want to integrate substance use disorder prevention, treatment and rehabilitation, cutting edge programs to do that, so that student nurses and then when they're practicing are so aware of these things. Because a nurse or somebody, a colleague of his, could have picked that up and say, hey, here's a resource for you. You don't have to lose your license. You don't have to get fired. You're sick. There's help out there. And emphasizing that in a non-judgment perspective, from a helper standpoint, is very, very, very important, so that we don't lose wonderful people like him. What a loss for the hospital, for this guy who you relied on so much to be gone, fired.
Love this is that just popped into my brain because I haven't thought about it for quite a long time, and I thought about that because he had a passion for what he did, right? He was clearly he was awesome, and but I would suspect the embarrassment that he may have, and any shame around it, any guilt around it. I mean, all those other emotions that just, drop you into this pit that you carry, and that keep you there because of that judgment. And then all of a sudden you're in a situation you don't know how to get out of, right? And then even amongst your peers, because we know that burnout is an issue in healthcare, and the importance of self-care and your own well-being, that we together, it's like we're showing up to do work and to be present. And if we are depleted, and and especially in these times when we're working with very extreme cases, situations of compassion fatigue, right, can set in, or any kind of vicarious trauma where we're taking home situation. And I think I mentioned to you one time about one of the nurses. She said to me, she said, we had a patient who had a malignant tumor that was externally, it was the size of a cantaloupe outside of her body. And the nurse had recurrent nightmares over this because the vision, the image wouldn't go away. And so she wasn't resting, and she'd go back to work, and she had to physically handle the tumor. So there are things that, in the foundational training, the education, the reality of this at this level, the sensitivity at this level, right, is not all that you don't grasp it yet at that level. It's sort of conceptual, right? You might see some, but it's not until you are that person in charge and have to go through the your daily work, and then your day-to-day work, and you still have other patients, and you have a life at home. This whole thing about the lifelong learning, like you're saying, and the wellness, integrating wellness into the healthcare curricula and into the institutions themselves, must be right together. They must be parallel. They must be complementary, right? That's what I hear you saying.
Yeah, and then while we talk about this in school, probably not as well as we need to, and then the person goes into practice, and like you said, it doesn't click until there and then. So it's very important to empower the practitioner, in this case, that nurse, to recognize this is not normal for me. So I need to seek help without thinking that some people might think I'm going crazy. You know what I mean? It's just, I think it's very important for all healthcare professionals to feel free to seek mental health counseling so that they're empowered to deal with this the constant bombardment of all these different experiences that they encounter at work. I mean, it's very important for people to catharsis, right? We tell our patients to say, okay, need to journal, right? When you had what? Food poisoning, you have to throw up, right? You have to remove all this poisoning from your physical body. So we're not, I think it's not there, we're not fully aware that indeed this toxicity, this negative experiences that we're having and all that stuff compiled and dumped into our system need to be catharsis. And how do you do that? How do you do that? And, there's no stigma associated with throwing up when you have food poisoning, but a lot of times people are hesitant to seek help, to throw up all these negativity that has come into their system. And and before we know it, people resort into drug use. People resort into bullying behaviors, and all these things manifest because we've been constantly suppressing all this negativity, and pretty soon it manifests externally in awful ways that could have been prevented.
And like you said, I mean, it's cumulative, right? It's a cumulative thing, and part of also the stigma is like maybe the perception of I can't do my job, right? That if your boss, your nurse manager is going to say, well, that's part of your job, right? So from the buy-in from the top needs to be there to support that there are situations, because I remember too listening to a therapist who does some specialty work with pelvic floor, and she was traumatized. She herself had some history of trauma, and during the assessment, the patient was triggered, and in turn, she got triggered because there was a question, an area of gray about could this escalate into a violent situation because of the patient's history, their own history, and then the therapist has had a history of being violated. So that huge question mark was, in that moment, making clinical decisions to control the environment, to ensure safety, number one, because that's what it really is. Ultimately, we don't want anyone getting hurt. And she was able to, you know, bring that down, like have everything calm down, and she had to be present to herself first. She first had to be like present to, is this mine? Am I perceiving this in her own reality check, her own personal reality check, to be in tune with herself? Or is this something that is a real issue, that my safety is in jeopardy? So those things do come with the ability to discern, right? To work on our own regulatory self-control, right? Management, self-care management. And it comes with teaching and practice, which really should be part of the foundational training that all students, medical students, nurses, therapists, all aspects of healthcare go through. Because I like to tell people, you know, working in healthcare is not for the faint of heart. I mean, this is, you have to prepare. You must prepare mentally, physically, emotionally for what you're going to face, because another human being with all their challenges, you know, we get to show up, and then what transpires in that space. And I know in the clinic, we are having, and because of the shortage in funding for mental health services in general, period, is that we're seeing more mental health comorbidities come in with the rehab setting. And it is, we have to be careful in our approach, that events and language that we use, the tone of voice that we have, you know, and I say language, not just what we say, but our body language is not threatening, right? So all those things, you know, they're not being taught in school. And
It's true.
right,
You talk about emphasizing this in school. And the sad thing is that, for example, nurses have to take NCLEX, right? Their licensure examination. And the things that are asked for in the NCLEX are, there's a huge component of the physical component. And there's not, you know, so nursing school programs need to prepare these nurses for the workplace, as well as to pass their licensure exam. So a lot of times, the things that we talk about, the things that need to be there in order to take care of oneself physically, mentally, emotionally, and spiritually, as well as doing that for patients and populations, are can't be covered because our curriculum is crammed with so many things. And so how do you find a way to reach our students and our nurses with this cutting edge information? You need to take care of yourself physically, mentally, emotionally, and spiritually, so that you can give the best physical, mental, emotional, and spiritual care to somebody, right?
exactly.
So yeah, I think that that's a huge challenge for schools, for organizations, for communities, and it is a challenge for all of us to find ways. And how do we do that?
Yeah, and as I listen to you say that, you know, it reminds me of, like, you don't, it feels like, first of all, time, the element of time, but to have something else to do. So if you look at this piece as being like something else we gotta do, when it's not something else we have to do, it is essential to what is required of us. And therefore, if we don't, it needs to be along the continuum. It not just in the school. It needs to be in the facilities themselves, that everything is reinforced, because the community element, the peer support, the the professional support along this personal, very personal growth path, right? They are hand in hand. They're not exclusive. They're hand in hand as human beings, right? That respond and connect on levels that matter, and through the heart, right? It is, a lot of studies around our heart field, heart intelligence speaks to the fact that we're in each other's fields, whether we are consciously aware of it or not. We are in each other's fields, and if there's static, and if there's stress, and if there's tension, right, this can feel like resistance. We bump up against resistance where we don't feel like disclosing information, whether it's the patient saying, I don't feel comfortable to talk to this particular practitioner, and then someone else gets the information, and then there's question, well, how come they told you and they didn't tell me, and I'm their primary, that kind of thing. And so that's where you see the dynamics of how we interact peer to peer, you know in our facilities, and and ultimately, getting back to that point, is that the integration of self-care is along the continuum, and the sensitivity and the recognition of our own vulnerability in practice should be part of the discussion.
Mm-hmm. Very much a part of the discussion. And like you said, it should not, I like what you said, it should not be considered as an added thing, but integrated into this whole process so we cover it.
Yeah.
Yeah.
Yeah. And I hope, with things, because clearly with this situation that we're in now in healthcare, with the COVID response, is that the way forward, what can we do to create a new way forward? Because this sort of thing, I mean, I've tried it personally. I can't escape. I'm like, okay. But, it's really brought me to some revelations. And I cannot say it's been comfortable, all right? Because I've been out of the clinic for 9 weeks. And I work, my job is very engaging, very physical, very emotionally, socially. Like, it is quite the experience, and I love it. I love what I do, and I feel personally that I've been like plucked, and then all of a sudden I'm addressing my own identity. Like, who am I? And I've been in practice. This is going on 26 years for me. So I feel that the ability for us to come forth with this information, honestly, what you're doing, right, which I want you to kind of maybe share a little bit more, like, what are some of these steps that you're wanting to help implement or bring to the table, because this is an opportunity to create new, and I think the empowerment of our healthcare professionals, our doctors, our nurses, our therapists, everyone, our CNAs who work so hard honestly, and everyone that is in the hospital space, it is such a honor to be there, because people's lives are at stake, and at whatever point in time they are, people are usually frightened. People usually, like, there are a lot of questions and uncertainty, and healing. It's supposed to be a place of healing, and
holy ground. Hospitals are holy ground.
exactly, and where is the respect and honor and care, right? And it has to start with the individual. Your presence matters,
Mm-hmm.
and so this this way of being and recognizing our own influence, you know,
Yes.
it's important. So,
And I think that the ability to keep that in one's dashboard depends on self-care,
mhm.
right? Deborah, it's you need to take care of yourself so that you're able to keep your sense of purpose right here. I'm going to a healing place and I'm going to help somebody get better.
Yeah.
And I value myself because of that. But I think often in workplaces that are so chaotic and so short-staffed and all that stuff, you lose that. You lose that. And then you get home, you're so tired, family, you have to switch roles, you have to take care of home. And a lot of my students, they work, they go to school, and they take care of their families. Unbelievable how incredible. I salute my students for being able to juggle that, and therefore it's very important for us as teachers, as influencers, as colleagues to be able to remind each other. I like the vet's I am my brother's keeper.
Mhm.
I was hoping that we could launch a program within this initiative of lifelong personal and professional development, um, a movement called I am my colleague's keeper, and that you work in a buddy system. You get to know this person well, and you look at you're in essence brothers, right? Taking care of each other. So I think the programs that we want to create, there's a role for the individual, there's a role for the colleague, and there's a role for organizations, there's a role for the State Board of Nursing, there's a role for all these different agencies. When I worked in tobacco control, the wonderful thing is we had a comprehensive tobacco control plan for the state. And with that comprehensive tobacco control plan, we had interventions in the community, we had interventions in the hospitals, we had interventions at the business level, we had smoke-free laws and all that stuff. So when all these things work together for us to have decreased the prevalence of tobacco use in our state. And that's the framework that I'm looking at. We need a comprehensive wellness initiative for our state, right? And possibly for a wellness initiative for healthcare professionals. But I know that it's not just healthcare professionals needing this, right? Our patients, our communities need this. And so perhaps drawing from the American Nurses Association's Healthy Nurses, Healthy Nation movement, it will take a comprehensive approach to help us shift, from constantly just reacting to suicide, reacting to bullying, reacting to all this. So looking at it from a comprehensive standpoint and from a public health standpoint, look at upstream, what are primary, secondary, and tertiary prevention interventions that we can do in order to surround our healthcare professionals surround the world, individuals in the world, with all the tools that will help them become fully actualized, physically, mentally, emotionally, spiritually healthy individuals, healthcare professionals.
Yeah, and you know what we are also is education, uh, big part of what insurance wants to see, right? In healthcare, one of those check boxes. But more than a checkbox, it really is about how do you best care for yourself. You know, so when we have conditions, you know, diagnoses, whether someone has diabetes, heart disease, any of those conditions, or whatever it is that their ailment might be, that we are able to learn how to best care for ourselves. And the model of care really should start with the professional who walks in, who can, you know, speak to that, who can embody that. And, you know, and it is a practice. It is deliberate. It is intentional. You know, this is not something that passively happens on its own, right? And, you know, so I really appreciate this conversation because it's not optional anymore. Like it just is not. And this the crisis that our providers have just, you know, especially in New York, right, with that peak of and demand, the intensity of service was extraordinary. And you know, to think about where we were before this came about, they didn't run off of a reservoir full, overflowing. They came from overwhelm, but they entered into their hearts and they were driven instinctively to do what is innate to human beings, really in their heart, to care. And and so that expenditure of love and concern and attention, personally, I have not seen that level of uh, consistency and community. Um, I can honestly say for the majority of my time in practice. And it is as tragic as this has been, for all the loss. That part of what I have seen for healthcare professionals and the attention to them for what they've been through is worthy of, now let's really continue this attention to what it takes, because it is their competence, what is required of them is more than the physical showing up, right? And we see it. So this is prime time. And I greatly appreciate like what you are saying and what you are working with, as far as creating a framework and introducing it, to make it so. This is just non-optional, and that is my platform to feel that, for me to continue to sustain too, right? Like it's a we thing. It's not you or me, it's a we thing. And that's how we should practice, right? It's a setup for a win-win all around, right? And it's palpable.
There's just one of us here.
Yeah.
Right, Deborah? There's just one of us here. When you're well, I'm well. When I'm sick, you're sick.
Exactly. And it really is a palpable thing, you know. And when we're in tune, we can feel that. When we can really feel this thing, and it's like it's freeing, and it allows us to feel safe in that space, and that opens us to healing, you know. And it reinforces itself organically. It has its self-perpetuating. So yeah. So, you know, just Thank you so much for everything.
Thank you. Thank you for having me.
Yeah, I mean, I would love for us to have, as things go along, to, you know, revisit this and see where you are, you know.
Absolutely. Absolutely. And I look forward to being in your workshop.
Thank you. You know,
Yeah.
this week, today's Wednesday, yeah. Um, Monday night, I'm telling you, I had this rumble tumble where my rest is not even restful anymore, because the stuff that I have been working on for so long is all like, I had 4 pages of information that it woke me up. I had an hour going back and forth in and out of bed because stuff kept coming to me, and it's just time, you know. And so I feel that this 9 weeks of not working, but my mind is working, my heart is like, oh, what's going on, is this is just the time, right? And we can feel it. You can feel it, and you can see through the issues that are surfacing, right?
Yep.
That it's, we just have to bring it all together to make it
Mhm. And work together.
yes, exactly, the collaboration, absolutely.
Absolutely.
So Dr. Files, I just thank you so much. And
Thank you, Dr. Howell. Thank you so much for this opportunity, and I look forward to our work together.
yes, same here,
Thank you.
for certain. Okay, let me stop this recording.